Welcome to St Vincent's Private Hospital, Melbourne. Thank you for trusting us with your treatment and care. Your wellness and safety is our top priority. St Vincent's Private prides itself on personalising your care to achieve the best outcome for you. Please take a moment to watch this important video to prepare for your stay and highlight how you can partner with us to achieve your care goals. On admission to the hospital, you will have been given a welcome pack, which contains information about your healthcare rights, staying safe in hospital, our pastoral services, and how to raise concerns and provide feedback. It also contains a My Notes page, which you may find useful to jot down information or questions to ask your doctor. We encourage you to use the checklist on the back of the My Notes page to help prepare yourself for going home. Also, we suggest you keep the welcome pack handy during your stay so you can use it to store the information handouts provided by our care team. At St Vincent's Private, we believe that respect and dignity is both a right and a responsibility of all staff, patients and carers. The Australian Charter of Healthcare Rights outlines your healthcare rights and what you can expect when receiving care. Refer to your welcome pack for further information about your healthcare rights and responsibilities. If you have any concerns, speak up. We want you to feel welcome, valued, and safe in our care.
When you're admitted, an identification band with your name and date of birth on it will be placed on your wrist. It must be worn at all times. To ensure you're receiving the correct care, staff must check the details on your ID band before giving medication or carrying out any treatment, tests or procedures. Any member of the hospital staff entering your room will introduce themselves and let you know what they are there to do. If someone does not introduce themselves, please ask them to do so. You'll be shown two remote controls. One of these operates your electric bed. The other controls your television, lights, and most importantly, is used to call your nurse. There is also a nurse call bell on the wall in all ensuites and bathrooms. You'll need to know how to call your nurse, so if you're unsure, speak up. For your safety, make sure your call bell is within your reach at all times.
Located on your wall is a care board for communication. At the beginning of each shift, your nurse will introduce themselves and write his or her name on the care board and update your treatment plan. We encourage you and your family to write on the care board too, or ask the nurse to add information for you. You can include the name of your primary contact person. You and your family can also write any questions or concerns you would like addressed by staff. For example, you may use it to remind yourself of questions to ask your doctor when he or she visits. Your safety is our priority. The best way you can help with your safety is to speak up if you have any questions or concerns.
If you have any questions about your medications or side effects, speak up. If a tablet looks unfamiliar to you, don't take it until you've found out what it is. If you have any concerns about your medicines, speak up. It's important that you feel comfortable during your stay. You may not be completely pain-free. This is normal. We will monitor you to make sure the pain relief we are giving you is not making you excessively drowsy, dizzy, or nauseated. Please do speak up if you feel you're experiencing unwanted side effects or your pain control seems insufficient. Your doctor can then consider prescribing different medications. If you're unsure on how to manage a sling, brace, or dressing and you're going home, please speak up.
Blood clots in large veins of the legs and arms and clots in the lung require immediate medical attention. Major surgery, immobility, severe infection, obesity, and age over 60 years are some of the high risk factors for developing these types of clots. Blood thinning medication, use of a compression pump, and wearing compression stockings may be recommended by our team if you are at risk. You can help stop the clot too by gently exercising your feet and legs in bed and getting out of bed and walking as soon as you can. If you have pain in your legs or chest, or experience difficulty breathing, speak up. If you experience any of these symptoms, it is important that you call the nurse immediately.
A hospital is a place with many sick people. It is important to prevent the spread of germs and infections. The best way to do this is by cleaning your hands. Anyone entering your room, including all staff and visitors, must clean their hands. They can either use the alcohol foam or wash them with soap and water. If you're unsure whether a staff member has cleaned their hands, speak up. For your safety and the safety of other patients, if your visitors are unwell, please ask them not to visit. They may call instead.
Pressure injuries, commonly referred to as bed sores, can occur from unrelieved pressure or friction and result in damage to the skin and underlying tissue. There are a range of risk factors, including being confined to bed or a chair. If you are at risk of developing pressure injuries, our staff will discuss a prevention plan with you. You can help by changing your sitting and lying position as much as possible, not putting pressure on bony or sore areas, and by eating a well-balanced diet with plenty of fluids. If you notice any areas of your skin showing changes, or if any areas are painful, speak up. Alert your nurse or doctor, and together we can help prevent pressure injuries. To keep you safe and comfortable, your nurse will check on you regularly throughout the day and night. When nurses are handing over information about your care and treatment plan, we encourage you to get involved. Ask questions and let us know if you have any special needs.
Clinical handover is where staff meet with you to discuss your plan of care for the next shift. This is an ideal time to let our nursing staff know if you have any concerns, suggestions or questions about your care.
Our staff are trained to notice changes in your health. You and your family can also help by letting your nurse know if you don't feel well, if you think your condition has changed or you think something has been missed. Use your call bell and speak up.
Eating well in hospital is important as it can help you recover from illness more quickly and allow you to go home sooner. Let staff know if you have any special dietary needs, require assistance at mealtimes, or if your appetite is poor. If you have concerns about your diet, please speak up.
Falls are the leading cause of injury in hospital. Falls can cause serious injuries and long-term disability. To help prevent falling, do not walk in the dark. Turn on the light. If you have a walking aid, such as a frame or stick, always use it. If you are not 100% confident standing and walking, please call your nurse. Speak up. We may provide you with a pair of ruby red socks. These have a grip sole and also let staff know that you need assistance. Always remember, call, don't fall, and speak up. Your safety is essential, but we must ensure that our staff are also safe. Helping patients to move in an unsafe way, as well as repeated lifting, are the two leading causes of staff injury. To keep everyone safe, we use a variety of specialised equipment. To help you move yourself, you may be shown how to use equipment such as overhead poles and leg lifters. Because of the risks involved, staff are not permitted to lift you, including your legs back onto the bed. If you need staff assistance to move, staff may use equipment such as slide sheets, standing aids and hoists.
We want to provide 10 out of 10 care. If you have any concerns, we would like the opportunity to resolve them quickly. Please speak to your nurse. If you are unable to resolve your issue, please ask to speak to the nurse unit manager. We value your feedback. It provides us with an opportunity to improve the way we deliver care to all patients and allows us to pass on positive feedback to our staff. When you go home, you will receive a text message from the hospital which will ask you, on a scale from 0 to 10, how likely you would be to recommend St Vincent's Private to your family and friends and the reasons for your score. We also distribute a more detailed survey to randomly selected patients twice yearly. We appreciate you taking the time to complete this survey if received. Thank you for watching this video. We hope you have a comfortable stay and wish you well for your ongoing recovery. For further information, please talk to our staff or refer to our website.